Good evening, doctors. Welcome again. Today we are going to discuss about respiratory mrcp MCQs. This is part G. A B C D E F parts I already discussed. Okay. A 45-year Caucasian man presents with shortness of breath, nasal congestion and epistaxis. Remember, nasal involvement due to congestion and epistaxis. Examination: ulceration of nasal septum ulceration, palpable purpura on lower extremities, chest x-ray, diffuse patchy infiltration on x-ray, lung involvement, urine analysis, hematuria, proteinuria, red cell cast. Triad: nose involvement, upper respiratory tract, lung involvement, lower respiratory tract, and renal involvement, and purpura of skin. What is likely diagnosis? So this is a case of Wagner's granulomatosis, and here C answer is positive. Okay. Now, 40-year-old Irish woman, presents with cough, fever, pain, and stiffness affecting the small joints. Remember, cough, fever, pain, stiffness affecting small joints of her hands and feet. Examination: she has nodular rash also, anterior shins, that means erythema nodosum. X-ray differentiates hilar lymphadenopathy. What is most likely diagnosis? So this is a case of sarcoidosis. Okay. 52-year-old smoker with a history of COPD on maximal medical therapy, increasingly disabled by her condition, is given life expectancy of 2 years. FE1 is 15 predicted. She is referred to tertiary referral center for lung transplant assessment. Which of the following is not a contraindicated to transplantation? So not contraindicated is age more than 50 years. This is not contraindicated for lung transplantation. With regards to pleural fluid drainage, so guys, think which is single best answer. So single best answer here is less than 2 liters of pleural fluid should be drained at any one time in case of causing re-expansion or pulmonary edema. Okay. These are the explanation. You can pause this video and read by your own. Now, 65-year-old presents with worsening shortness breath on exertion, non-productive cough. On examination, she has finger clubbing and fine and respiratory crepitation by bustle on chest auscultation. You suspect a diagnosis of idiopathic pulmonary fibrosis. Which of the following findings would you support your diagnosis? So here it's predominantly lymphocytic bronchoalveolar lavage fluid. Okay. Alpha-1 antitrypsin levels are lowest in which phenotype? Lowest in PI-ZZ phenotype. Lowest. In which of the following patient long-term oxygen therapy not indicated? So, think guys, which one is the best answer? 65-year-old woman with severe COPD and PaO2 of 8.2 on air. Okay, this is not recommended here. So hope it's clear. Now discuss another MCQ. A young man with cystic fibrosis comes to see you in clinic for review and would like to know more about the complications of conditions. Which of these complications is seen more frequently in man with cystic fibrosis compared to woman? In man, we see infertility in case of cystic fibrosis. Okay. So, sorry guys, one answer I put wrong. So, this first one answer is predominantly neutrophilic bronchoalveolar lavage for cystic idiopathic pulmonary fibrosis. Remember. Okay, there explain. A 28-year-old woman with a history of chronic rhinitis and non-nasal polyps develops symptoms of exertional dyspnea and wheeze Which of the following medication may have contributed to her asthma symptoms? That is aspirin induced asthma. Okay. 78-year-old man previously working in shipyard until 20 years ago present with gradual onset dyspnea with no chest pain. His pulmonary function test shows a restrictive picture with reduced lung volumes and transfer factor, which is likely diagnosis. So this is a case of pulmonary asbestosis. So guys, I already finished. These are the explanation. You can pause this video and read the explanation also, and if you like this video, put like on it. If you have any queries, any question, you can ask me, and if you new on my channel, please subscribe it. Thank you. Good day. Goodbye. That's all for today.